Yes, there's no capacity addition when it comes to the hospitality sector, but the hospital sector is seeing a lot of Capex. We've heard a lot of announcements come by from a lot of companies. So let's discuss one of them. Mr. Viren Prasad Shetty, the Executive Vice Chairman at Narayana Health, joins us on the show now. Hi, thank you so much for joining us, Viren. Just wanted to begin by asking you about your own Capex plan. I understand it's quite aggressive at around 1100 odd crores that you have planned out. Talk to us about the details. Which are the cities you are coming up with? What's the plan with respect to whether it's going to be greenfield, brownfield, or are you going to acquire something?
So our Capex plans are aggressive only in as much as we haven't really spent anything since the pandemic started. And a lot of this is catch-up growth to add a lot of beds and add ICUs, OTs, and a lot of capacity that our flagship units are really short of. So the bulk of this spend will be concentrated in 3 hospitals, our hospital in the Cayman Islands, in Bangalore and Calcutta. All of these are brownfield in that they are built adjacent to the hospital that we have. But in Bangalore and Cayman, these are in new locations.
Okay. Hi, Nikunj Dalmia also joining in. I just want to clear the air here. Is it true that you are looking at moving into the insurance vertical?
Yes, we recently started a subsidiary and we're going to soon apply for an insurance license. Health insurance and healthcare services are 2 very closely intertwined parts of our business. One does not go without the other. And the growth in the healthcare field will be closely mirrored by the growth in health insurance. And we believe that for a very large proportion of the population, the missing middle, there are very few options available to them. And so we want to offer something that's quite differentiated, that's very high on service and affordable to them.
The insurance sector is a business where you have to invest upfront and then gains are made after 5 to 7 years. That's been the story of the Indian insurance sector, the global insurance sector. Why would you like to venture into it where you have to invest upfront and the return ratios would be 5, 7, 10 years down the line? In fact, barring 4, 5 companies, no health insurance company in India is also making money.
I mean, that's true of the healthcare services sector as well. We make these massive investments in hospitals with very uncertain demand. We build hundreds and hundreds of beds all over the country, hire a lot of doctors with no guarantee that either patients will come or patients will pay what it costs to provide the services, or absolute uncertainty on whether the government will just regulate all the prices. So uncertainty is nothing new to this sector. But what we believe is that in India, healthcare penetration is extremely low. As a population, even for people who can afford, they are not getting the healthcare that they are entitled to. They are very unlikely to get treatment. They're very likely to get any diagnostics done. They're very unlikely to get their checkups. And thus we suffer terrible health outcomes. We are the diabetes capital of the world. We are the heart disease capital of the world. We are the kidney dialysis capital of the world. It's all just things that are easily solvable with easy access to healthcare. So we believe in Indians wanting to take more care of their health. So regardless of the fact that these things take a long time to break even, it's something we're used to. And this is not, very different from hospitals.
So Viren, tell us about, the status of your new hospitals. Your Mumbai facility did turn EBITDA positive, as I understand, recently. When it comes to Gurgaon or Gurugram as well, you also showed decent growth over there. But since both have margins in single digits, by when do you expect them to, gradually improve and perhaps touch double-digit figures?
In time. I mean, this is a business with very long gestation period. It takes a very long time for people to first know where your hospital even is, where it's located. Then it takes a lot of time for them to trust you. And that requires a lot of time for you to do surgeries, for the surgeries to be successful, for them to go back home and tell other people about it. So hospitals just generally take a very long time to break even. It's taking much longer these days than it did when we started out. Back then, in a year or 2 years, you could break even. Nowadays, it takes 4, 5 years. And it takes at least 8, 10 years to generate a decent return on capital because the costs have gone up much more than the realizations per procedure. So these are very long dated things and it will happen. It won't happen soon, but we're on the path to getting profitable in all these hospitals.
Give us a few more details in terms of how the business is right now. What are the occupancy levels? What's the average revenue per bed? And going forward, what your expectation is with respect to the medical tourism and the increased numbers from there?
Yeah. Our occupancies across the hospitals hover anywhere between 60 and 75%. realizations per bed generally is much less than the competition. And in fact, compared to the top of the market, our realization per bed is about half. And that is where we want to be. For us, our target segment is the mass market and the middle class. And we dedicate a lot of our capacity towards serving those who really don't want to pay top dollar for a lot of the treatment that's there. Medical tourism used to be at around 11% of our revenue. It is now at 8%. That is a number that will decline over time because we are refocusing a lot of our services to be more locally oriented and try to be more attractive to patients in India and the underserved parts of India rather than running around the world and trying to get richer patients from there coming there.
Sure, Viren, but just a follow-up. You talked about the occupancies historically being 60-70% realization lower than the industry, but what's the outlook? What are you expecting, let's say, over the next 12 to 18 months with respect to realizations as well as occupancy?
Not much movement in 12 to 18 months. This is not something that moves over the course of a single year. One, because we are very capacity constrained. A lot of the investment that we are making in our Capex is entirely oriented towards adding more OTs, ICUs, diagnostic rooms, which will ease that bottleneck. So absent that, we won't be able to add that much more capacity to the hospitals that we have and increase the occupancy. Similarly, for the realization, it takes a long time for us to start moving into higher end procedures, for a lot of the price increases to come about, and we only take year-on-year single-digit price increases. So in a 12 to 18 months, it doesn't move up appreciably so.
Most of the hospitals currently have average occupancy between 50 to 65%. That's the industry average, if my understanding is right. And everybody is looking at expanding. So is it a good idea to expand when the capacity is between 55 to 65%, and especially when the peer set is also adding capacity?
What we're spending on is not just beds. See, ours is not the hotel business where people check out at 12 and check in at 2. Bulk of our patients come in at 8 in the morning. Bulk of our patients leave the hospital at 6 in the evening. So we're always capacity constrained in that sense. And the things that we are adding won't only add to beds. And looking purely at beds is the wrong way to look at our industry because, like I said, not the hotel industry. So a lot of this is going into outpatient areas, into diagnostics, into OT, procedure rooms, emergency rooms, the supporting infrastructure. So a lot of what we're adding is not beds. Now, to the larger point you raised, when capacities are low and everyone else is adding, is it a good time to add? You can't time this. The thing is, when everyone is feeling bullish, a lot of capacity gets added to the market. When everyone is bearish, we're all bearish at the same time, and no one is adding capacity to the market. And there's this general cyclicality to this business that is there across all industries. So it's not easy for any of us to time this, but now's the time we need it for ourselves. We're not looking at capturing more market share in different cities where we have no presence. This is what is desperately needed for our patients right now, who otherwise are facing waiting list and we don't have enough beds to take care of them.
Go by the number what you've shared with us and what is then public domain in terms of you are looking at doubling, let's say, in 4 to 5 years. You've always been an asset-light model, but the temptation to increase debt, temptation to perhaps raise equity when stock is at an all-time high is obviously there. In your journey to double in next 4 to 5 years, how will you maintain the financial discipline?
We don't have to raise equity to fund a lot of the expansion. We generate sufficient amounts of cash and we have a lot of support from our bankers to lend to us at attractive rates, and we have a good credit rating. So a lot of this will be funded through cash and accruals. And the portion, the amount of money that we're spending, at 1,000 crores and thereabouts for the next couple of years is very well managed within the amount of cash that we manage. We're not going all out. We're not over leveraging ourselves. We're not going to get into serious, levels of debt where an equity infusion turns out to be the most important thing. So at this point, this is not something that's part of our fundraising plan.
You've demonstrated a real success story in your Cayman healthcare setup. Would you be looking at replicating there in some other countries? Is that option available?
Yeah, the option is always available, provided you're willing to spend hundreds of millions of dollars to expand to all those countries. Now, we're being a little cautious and not looking to spend that much right now. And so a lot of these are JVs and partnerships and work that we're doing to find other players on different Caribbean islands that we can work with. So the option is there to make a large investment. We're not confident about that right now. So what we're looking at now is some very cautious JV type models that we can work with. And if it works out, if we understand the market better, then look at spending a lot more.
Okay. All right, Mr. Shetty, always appreciate, and thank you for joining us.
Thank you.